So Michael mentioned that a significant proportion of type 2 diabetes can be avoided through better access to healthy diet and to appropriate exercise. It is estimated that that figure is something like 70%.
So you see that the food, in order to change the food behavior, we need to do much more than developing guidelines.
Of course, healthy eating and physical activity are extremely important for all of us, as well as for the management of people who have diabetes.
So that is the concept of healthy diet, which of course needs to be translated into everyday choices.
The concept of the framework for action is to recognize that this is a multi-sector, multi-player challenge, and that if we work together, we can rise to this challenge.
To do that, of course, we need to live in a healthy food environment. And as you rightly said, and we very much welcome the policy mix that IDF is advocating for.
Then other tools we have used is taxation. In Finland there has been a sugar tax.
It was announced by the president, Enrique Peña Nieto, and I want to cite him because he said, and I'm quoting Enrique Peña Nieto, President of Mexico, "We must make clear that these measures do not go against any company or industry. They are for the most precious thing that we have, the health of our children and youth."
One of the big things that we've been trying to do is get into partnerships with the private sector, because as most of the panellists have identified, the private sector, particularly in terms of the production and sale of food, is one of the biggest players that can absolutely affect the health of individuals.
I was able to realize one of my dreams because I understood that if I manage my diabetes with a balanced and healthy diet, I would be able to realize these dreams.
And finally, we did manage to get the next World Health Day, which is the biggest advocacy day for WHO dedicated to diabetes next year.